try to have this for 45 minutes. Good evening, everyone. Welcome again to another session of our Thursday night presentation, Healthy Lifestyle from Yahweh's Kingdom Lifestyle Ministry, presenting yours truly, Juliet Allan. I'm a registered nurse based in Canada, and it's in my heart to share with you tonight with regards to another important topic that mostly probably missed the importance of checking our day-to-day lives, especially when we're experiencing pains and sicknesses, different kinds of ailments that we experience. So tonight's topic is the do's and don'ts of over-the-counter and prescription medicines. So when I say medicines, I can, you might hear me say drug as well, interchangeably, calling it OTC, the over-the-counter, short form OTC. So mostly part of our growing older, some of it, if not most, take medication at some point in our lives. So may not like taking them at all. But some in desperate moments, we go to the pharmacy, or a relative or a family share us an over-the-counter medication, which sometimes we hardly know the effect, the full effect, the side effect, and we think that this can cure, relieve, alleviate, or prevent certain ailments or ailments. So in my heart tonight, I just want to share this overview. I could say, as we have limited time, I would like to tackle some important key points or do's and don'ts on resorting to OTC drugs or medications, and also prescriptive medications. Some of the prescription medicines that you may have already explained to you by your pharmacist, as already ordered by your doctor with your permission, usually explained the effect, the side effects, the reverse effects that goes with the effect of the medication. So many times we are not taught of the side effects and also the adverse effects or undesired effects that goes with taking a certain drug. So there are also factors to consider in the effectiveness when taking them. So it's important to also consider the nature, the source, how it's being stored, because as some other medications will be needing to be stored properly to be effective and obtain the desired effect of the medications. Certain temperatures affects the length and strength of the medications also. So many times we are also told about the medication, what it's for, but we miss the most important thing is to read the label. So the label contains how often we use and how much we use for certain age, and it also gives you warning of other illnesses, and mainly to check with your physicians or your direct medical doctor attending to you. So tonight, I would like to share some important key points that also warning you or giving you important hints to go and check your cupboards, check your closets, check the medications or drugs or supplements that you take in, because even certain supplements can affect medications that you're taking simultaneously in treating or managing the already existing illness. So the effects can be effective, they can be ineffective for some reasons. They are also for short term, can have a mild or little risk effects, but also at the long run, especially when we taking them in the long term, can be toxic, fatal, or irreversible. So I'd like us to continue to be really keen and observant when it regards to what we're taking in, ingesting in to our bodies. Somebody raise hand. I would like to leave the comments and question at the end, but if it's very important, go ahead. Is somebody raising their hands? iPhone? All right, to continue on, I'd like to
Yes, I actually raised my hand. Because you were talking about over-the-counter medications, I just wanted to know before I forget, are there any like everyday, ordinary, over-the-counter medications that people may consider even harmless because they're taken so often but can be dangerous?
this is the reason why I would like to tackle this tonight, because I would like everyone to be proactive and really very observant and take precaution on everything, every medication that we ingest, that we don't even consider what is the long-term effect of it. And there's no really everyday use I would recommend, because every over-the-counter med should be only taken as necessary.
For instance, aspirin, I would think that, oh, it's just aspirin. I can take it all the time or anytime.
Aspirin is have to think about it, it's also medication. It has adverse effects, especially when you're taking them in the long term. There are lots of to consider. Consider the age of the person, what are the underlying sickness they have, if they already have um, other comorbidities like bleeding disorders. I wouldn't recommend, as the purpose of this presentation is to give awareness and also to motivate, to encourage someone to go and seek more knowledge about this medication. There are pharmacists, there are, other healthcare providers, your direct physicians. You, I would encourage everyone to ask about this question, because if I say, take daily aspirin and somebody can be pregnant, they don't know, right? So I wouldn't really encourage to have, or not coming from me to be advising this as um, a routine, or something like that. So if I say this, that would I would have predisposing somebody at risk. So it's very important. I will aspirin is one of those pain and fever relief medication that I most commonly used by everyone. But at the same time, aspirin, they say, as a cardiology nurse, cardiovascular nurse, with a heart patient already suffering from heart and vascular issues, sometimes they take this every day to prevent strokes. So I wouldn't even recommend to go further then, unless pharmacies are guided by the physician or medical doctor advising you to take this daily. And it has to be prescripted because the liability of this has to be monitored and supervised by a medical practitioner. So that's my recommendation. So uh, we can talk
Thank
about.
you. Thank you.
You're welcome. Thank you for your question, and I really appreciate that. And this will encourage me to really expound some more other specific issues. But at the same time, as I've said, I will just go over some overview, superficial key points, health tips when it's regards to over-the-counter and prescription medicines. So I'm going to open my PowerPoint presentation over here just to give a summary. Um, so there are really key points. As I said, that's why I cannot recommend this and that, because I'm going to go over factors that supports what I said. So talking about that, I'd like to share who are at risk, the age groups that are risks and vulnerable to the harm of taking or using drugs or medicines. I'd like to share my screen. So you are seeing the anatomy of the body. It starts when taking the medication, it starts from the mouth. So already when you take in the mouth or in the skin, the absorption of medication already starts. So there were different routes to consider when taking medication. That's why when you choose to take medication, it's very important, especially over-the-counter medication, because you can just go in a pharmacy and grab this medication and pay for them. But what I don't want you to miss is to read the label. The label will instruct you how to take the medication, meaning, is it in a tablet form, in a pill form, in a capsule form, gel form, in a liquid form? So they come in different forms, meaning also that they can be topical, especially the ointments or liniments. They can also be rectal, like suppositories. They can also be like eye drops or nasal sprays, patches. So all these different forms. So they have different routes to applying certain medications. So we would like to really be observant when we're grabbing medications, because they come in different forms and different labels and different stocks, and also different names and different brands. So it depends on the sources of or manufacturer of that medication. So they have certain instruction on how to take the medication. So it also instructs you when to take the medication, and also how to store the medication, also how long you take the medication, and it gives you instruction on to take precaution on smaller children, the pregnant, and the nursing mothers. And also it will tell you how to store once it's open. It can be refrigerated, it can be in a dark space or inside a cupboard. Sometimes medications affects by is affected. The length of strength of the medication is also affected by the temperature and the sunlight. So some are stored in dark bottles. Some can be stored in clear bottles that's not affected by light. And also, as I said, also maybe some medication also needing refrigeration or sorry, freezing, or and also certain temperatures. Some medication it will some drugs will tell you to store in a certain temperature and it's controlled. And also some medications that just stored in a room temperature in a direct light. So all this needs to be considered. That's why we have to be observant and read the label properly. And if you cannot read it and it's written in a different language, then you have to ask the pharmacy. Every country have different labeling. They can have a second language that's translated to it. And also different country have different body of the government to regulate or control the production, the manufacturing of that medication. So we have to know where is the source of this medication, because there are other countries that have different regulations, recommendations, and makeup or way of processing this medication. So all this we have to be aware. First thing, read the label. And also when you grab the medications, make sure that the seal is intact. The seal is not broken. It could be some important reasons, other reasons that, for handling or accidents and all that. You have to, when you grab them by the counter, you make sure that they're properly sealed. There's a complete label that is not fading, that is clearly being read, and it states the manufacturing date and the expiry date. So those are very important. So you want the manufacturing date close to the current date. They're fresher from the manufacturers, and they are more effective. Sometimes they've been in the stock for so long, even though the length of the medication takes 2 years, you want the medication that is closer to the manufacturing date or the current date to the manufacturing date. So a lot of times we forgot about them and they're still in our cupboards, and we forget to check the expiry date. So all this, we get to be vigilant and get rid of them right away. So that's why I just want to uh, expand that tonight and reiterate to check your medications in your cupboard right now or right away after this presentation and get rid of them. And also, if they are not being used, why do you want to keep them? So the longer it takes there, the lesser strength that it can do to you. And the more you get, you know, you don't get relief uh, from your ailments or aches. Age groups that are risk, as I said, and also the effectiveness or the effects, the harm, the risk from using these drugs affected by age. So the very young, especially under 4 years old or under 12 years old, we want to take precaution and ask questions from our pharmacy. Also, the very old, So now, because of the frailty, the sensitivity, the older it gets, the more we are sensitive to certain medications, develop some sensitivities, develop some reactions, allergies to certain medications, and sensitivities, as I said, and also we might not be um, really respond. The body cannot respond probably anymore to certain medications. Over time, there's resistance to certain medications, and your body no longer adapt or react to the effectiveness of these medications. Also, the very sick. So a lot of times, some people experiencing two, three different kinds of sickness at the same time, especially high blood pressure. They can be suffering from diabetes, a thyroid problem, cholesterol issues. So all these things, medications can be overwhelming, taking them much less, taking more supplements and other over-the-counter drugs. Also, we take precaution to the pregnant and nursing mothers. So if you suspect one is pregnant, then you have to ask question, is it safe? Is it really effective in taking this medication when I'm taking supplements or nutriments or vitamins and minerals to enhance my health? The nursing mothers, of course, some medication can pass through breast milk, so we have to take consideration the risk and the harm effect to the baby. And also, I'd like to emphasize that there are different types of drug interactions. So it could be drug nutrient, that means I say drug nutrient or drug food because the nutrient in the food can be reactive to the drug that we are taking. So drug interacts with the food, the beverages, and supplements and the person that is taking. Another is the drug disease interaction. Drug interacts with another disease the person has. So sometimes there are other comorbidities or other illness that a person is suffering. That medication can interact to already existent medication they had, or to the disease they had. The next interaction is drug-drug interaction. So drug-to-drug interaction the person is taking can result to different effects or effectiveness of the medication. So other drug and drug interactions can be alteration, which is modifying the concentration of the drugs. So taking some supplement, some medication or over-the-counter medication can modify the concentration of the drug. Even beverages can dilute the concentration of the drug, and sometimes you are instructed not to take medications with certain beverage or food or other um, nutriments that will affect the effectiveness of the medication. Uh, Another one is intensification. So it duplicates or strengthens the effects of the drugs. So for example, when two drugs with the same effects are taken, their side effects may be intensified. So that the intensity of the effect of the medication is intensified by taking another same medication when treating or alleviating um, ailments. another type of drug-drug interaction is opposition. This is reducing or even counteracting the effectiveness of the drug. So for example, two drugs with opposing actions can interact, thereby reducing the effectiveness of one or even both. So for example, ibuprofen or Advil, which is taken for pain relief, can cause body to retain salts and fluid, and also that will oppose the effectiveness of medications for removing water in the system, such as Lasix and other medication, prescriptive medications, or even other supplements. So those are the main issues that are main interactions that I want to point out in explaining the drug-drug interaction. So now I want to give you overview of the most common over-the-counter medications that we usually take at home or other workplaces. Or, as I mentioned before, maybe somebody share it to you for pain relief or fever relief, and we don't even know, we take them with haste, and we don't even consider what we have and what already we have or what already taking. So as we go along, especially those who have medications or prescription medicines, or already have other supplements or nutriments that they're taking, I would recommend that you guys make a list of all the medications, all the supplements, nutrients that you're taking, especially when you're going out, when you're traveling, especially that you may face certain situations that you need this information, and they're at hand. And present them to a pharmacy, or to a doctor, and then we could explain properly what you have. So in that way, you're up to date, and really, when you go to your doctor, you have more questions, you can go over it, you can update them. So those are another tips I would like to share. So first, group of commonly used of OTC medications or OTC drugs are medications for pain and fever, like acetaminophen, NSAIDs. NSAIDs means non-steroidal anti-inflammatory drugs, such as Advil or ibuprofen, diclofenac, mefenamic acid, indomethacin. Some may be familiar to you, and in different countries, they come in different labels. And as I said, there's different naming of this medication to just um, to be considered. Some use generic name, and some use brand name. So they might sound familiar, they might come in different names. Also, another one is aspirin, as I said, used to relieve pain and fever. So I'd like to re-emphasize that acetaminophen, like Tylenol, they are really detrimental at the long chronic use of them can be toxic to organs of the body, especially the liver. If taken in high doses and more often, and if it's chronic or long term, then over time it damage the liver by having a hard time detoxifying it and eliminating it from the body, and that cause inflammation of the liver. So that's just want to mention and give that an overview. Another medication, ibuprofen, Advil. It is very dangerous when when we may know, we might think that it's very effective on pain relief, and every night you're taking it, or on daily basis, can be detrimental to the kidneys, and it causes trouble and more severe and dangerous problem at the long run. So as I've said, I always recommend that you take these medications as a relief, a temporary relief. And first, I recommend that you use non like other relieving measures that are other than medications, like heat packs, cold packs, also fever reducing measures, like taking cold drinks or other pain relieving measures that or we know. Maybe next presentation we can identify some measures, and you can recommend some relieving measures that were effective on your daily basis and dealing with this sicknesses. Next group is the common cold medications. Sore throat, stuffiness, runny nose, hoarseness of voice, and body aches. We resort to cold medications, and some of them are, you may be familiar with, the DXM, dextromethorphan medication. So this, the DXM, like Dimetop, all these medication can cause inhibit cough, and also stop the, the cough or relieve the common cold symptoms, the stuffiness, headaches as well. So there are other content on this medication that causes side effects that would also we need to be cautious with. Robitussin, maybe you're familiar with that, triaminic Vicks, especially the oral liquid form. And of course, we have to use this cautiously with children under 4 years. That's why they are in, sealed bottles. They are not to be just left anywhere for children to access. Guaifenesin, as I said, Mucinex, Sudafed. You probably are familiar with that for nasal and sinus congestion. To mind you, this nasal and sinus congestion medications, some individuals who have high blood pressures, palpitations, or rapid heartbeat should be taken consideration and stop its use and seek for advice, because that could increase the side effect of the medication. Cepacol, we use to relieve sore throat. Again, acetaminophen and ibuprofen. Another group of medications are medications for when you're suffering sneezing, runny nose, watery eyes, especially in the spring and summer when allergic reaction or certain allergies, especially in North Americas, do suffer from these symptoms. So some may take Benadryl, it's an anti-allergic reaction, antihistamine medication, Zyrtec, Allegra, and Claritin. So this medication, to mind you, would give special consideration and caution, because these medications can cause drowsiness or sleepiness. So when you're doing manual labor, especially factories and operating devices or driving, so I advise to take extra precaution with taking this. Take them when you are, give extra lots of time before you plan to drive to plan to operate or even um, do work or activities that will really endanger your um, mental clarity at the time. Like say you just don't want to be so drowsy and you cannot concentrate on your work. That will predispose you to risk. So next group of medications are stomach is for stomach upset, diarrhea, also heartburns, bloating, seasickness, nausea, vomiting, indigestion, acidity, constipation even. So certain medications we need to take precaution on taking on these things, especially when we're dealing with some specific stomach issue, and then it causes you to have take medications, and then it will give you a reverse reaction or an opposing effect. For example, medication for stomach is Pepto-Bismol, used to treat heartburn or relief from heartburn. So to emphasize on heartburn, I would like to really reemphasize that what is really a heartburn is I would like you to be able to differentiate between a chest pain and a heartburn, especially if you see a person um, complaining of pain in the chest. uh, they might think they're having a heartburn. You might think it's something you have that can help them, but we have to make sure that it's not heart related. Especially, we have to ask the person a question if they have heart issues, if they're what's the characteristic of the pain. The heartburn is like it's just burning, just lower down the throat, and it can be mistaken as a chest pain or angina. And if it's related to heart, sorry, it's not heart. It's a typo. It's an emergency in nature. Another medication is for bloating, simaticone. Bloating may be caused by other medications we're taking, maybe other nutrients we're taking. Some cannot tolerate dairy or ingesting some other medication to make them bloat, and then you ingest um, over-the-counter medication. It can mask certain effectiveness, or it can reduce the effectiveness of the medication. Most dairies usually curdles, when you ingest them, curdles in the stomach, and that traps the medication, and so it reduces the effectiveness. Another medication, Dramamine or Gravel, they relieve nausea or seasickness and vomiting. But mind you, again, this causes sleepiness, drowsiness, and other side effects that we may need to consider and really investigate what are other side effects that we expect on these medications. Another medications are emetrol. Emetrol is oftenly used and preferred use by pregnant women or nursing women because they're less toxic and less in side effect. But then, to mind you, cannot be used or used cautiously with diabetic person because it contains carbohydrates, producing more sugar. Other medications are Tagamet and Zantac, Prevacid, Prilosec. They're used for indigestion. So when you're suffering from indigestion, people resort on this medication to aid in digestion. And really, some of these are actually our prescription medicine. Also caltrate, rolate, stams, milk of magnesia, malox. These are antacids. These are high calcium. They have high calcium content. So just to mind you, if you're you know we're taking this long term, these are it's calcium. So other medications for constipation, we resort to over-the-counter meds. They come as Bisacodyl, Dulcolax, Colis, or Senna tablets. So these are relief for constipation, and also they are laxative, so use cautiously. Also, we use them with caution with somebody who have peptic ulcer already identified having peptic ulcer disease or any form of bleeding disorder in the stomach. So that means that it's urgent to seek professional advice or emergent um, advice. Another medications are Imodium or loperamide. These are medications treat diarrhea and in any other symptoms. If they are chronic or have been going on, we may need to reevaluate or seek medical attention. It may be, the diarrhea may be a symptom of a more serious problem, and this medication need to be stopped. Another medications that others resort to are sleep aids, melatonin, also Benadryl. As I said before, it has drowsy effects, sleepiness, and others resort to them. Compost, Dominex, you may be familiar with. These have sedating effects, and use cautiously again with people who operate machineries or working with risk um, activities, operating really um, what do you call this? Those big machines like backhoes, lifters, driving. Those who are work involved with driving. Also, do not use with alcohol because it intensifies the effects and it can be really detrimental. I think this is the list. A group of medications, allergies, and itch. I mentioned before allergies, but another effects or interaction of drug to self causes us to be sensitive or can be fatal and is resort to allergic reaction. Some people would go to the counter and grab more Benadryl for itching, when you're suffering from hives. These are antihistamine, and also, again, they have drowsy effect. Nasal cram, cromolyn, sodium, Zyrtec, Claritin, Allegra, as I said before. These are all common allergies and itch medication, anti-itch medication. And these are usually not life-threatening. However, difficulty breathing, wheezing, hoarseness, or difficulty swallowing may be a sign of life-threatening allergic reaction called anaphylactic shock. So this is an emergent situation. Call 911 or seek medical attention right away. And furthermore, down the road, when we again raise some questions or comments or issues about this topic that I went over with, then you are open to do so, and we can discuss specifically those comments. So you would notice that I only touch some OTC drugs, and you may know some other ones, so you may share next time. And if you have question about them, then you can direct them, raise them, and we can see and expound, give you more knowledge about them as much as I can. So for that, again, use them cautiously, read labels, seek advice. They are free from your pharmacist, from your doctor. So just to increase all your knowledge about certain medications, um, knowing the risks, the, the harmful effect, the age, and all, and different, you have to be vigilant on really just pointing out all these important tips that we have discussed when we are before we take them. So next time, if you have more questions, we'll go over them. So I have 5 minutes to entertain question, then I will close the platform. And so next time, save your comments. And really, thank you for your participation. Thank you for your listening. And it's live in Facebook, so you can just drop some comments and, you know, see what I can help. So for any questions and comments, please send them to Facebook link, Yahweh Kingdom Lifestyle Ministry. And this is Juliet Allen saying good night. Before I say good night, I give you 5 minutes, right? So, all right. So you can raise your question, ask your question, and by all means. iPhone, do you have any question? DA, do you have any question?
No, no question.
Thank you. iPhone, do you have any question?
I asked my question at the beginning, but you did go over it, So I don't really have something that I'm sort of in doubt about right now. You covered just about everything.
Thank you. And if you have any more, like anything that comes into mind, next time, Father's will, down the road, we can discuss more medications. And I said we only tackled some most commonly used over-the-counter medications. And these, I just want to tackle them right away because I want you guys to go and see what you have. And, I talked to you about checking the labels, expiry date, toss them out if they're expired, and get fresh ones, and use them only for pain relief. And, these are not to treat the illness. These are only temporary and pain relief. So, we can discuss more specific about these medications next time. And also, I haven't tackled on the nutrients, the nutriments, the supplements that we are taking or giving to our sick loved ones, our elderly loved ones, also our young ones, and what they're, how to take them more effectively to get the effective result that we wanted. So thank you again. Thank you so much for being with me. I really appreciate your participation, your support, and continued support on this platform also. So thank you so much. Thank you. I really appreciate it. And thank you for the one that managing this platform, Brother Bradley Joseph. Thank you so much. And again, this is your presenter, Juliet Allen, saying good night, goodbye, and take care of yourself. You're the one who should be proactive on keeping these bodies healthy And so we can achieve a longer life, healthier and happier. So thank you once again. Shalom.
Okay, shalom, shalom.
Shalom.
Daniel.